Dave Mason, you originally came in because of what, Dave?
I had a herniated lower disc in the back.
Okay.
Started April 28th last year. And I had been to an orthopedic surgeon, I'd been to a general practitioner, an osteopath, and another chiropractor, and about 27 sessions of therapy and 14 sessions with another chiropractor.
Wow.
3 spinal epidural injections of steroid, probably 5 C-packs of prednisone steroid.
Wow.
And in between all that, muscle relaxers, anti-inflammatory drugs, as well as some oxycodone for the pain. And then in between, I was taking ibuprofen, I was taking Tylenol, anything to ease the pain. I had lower back pain, to the point sometimes where I was horizontal and very difficult to even get upright. And then at other times, most of the time, constant pain from the glute on the left side all the way down to the toes in my left feet.
Wow.
So I started here with Dr. Leonard in mid-February, and I started on a consultation with him on nutrition and health, and he went through my MRI and my x-rays with me, probably more thoroughly than any of the other doctors had. And we started decompression therapy and some adjustment therapy, and also the nutrition and diet. I changed my diet completely. I went into his anti-inflammatory diet. And in the last few weeks, I have had no lower back pain. I've had no pain down my left from the pinched sciatica. So it appears to me, it seems to me at this point, that the sciatic nerve is back in where or the disc is back in where it needs to. It's off the sciatic nerve. And I'm able to walk and stand and take long walks, and that was one of the problems. I couldn't stand very long, I couldn't walk, and the only thing I could do for any length of time was sit, and then when I get up, I paid the price for sitting so long. And so it's been quite a healing process for me, and quite an experience. Life change.
So, anyways, well, you also had the vertigo, dizziness issue as well. And the reason why I bring this up, because a lot of people don't understand the relationship between inflammation and this whole body connection, you know, because you came in thinking probably all you need is your back worked on, right? But here you said we put you on an anti-inflammatory diet. We went ahead. Go ahead.
And I had vertigo a few weeks before I came in here. And I had another chiropractor that tried to treat me for that with some sort of maneuver that you do. And so I spoke to you about that, and you actually did a procedure on me that flushed the ear.
The caloric, an ear caloric, yes.
And that helped. And then the second one completely got rid of the vertigo.
Isn't that amazing?
I mean, I couldn't lie down and get up without my eyes rotating in my head and the room appearing like it was spinning. And so that helped tremendously.
Isn't that awesome? So the reason why I bring that up, because there's a lot of people that come in here for vertigo. They don't understand the whole body connection. Now, would you also mind mentioning your thyroid issue as well? Because that's how we traced it all, that you had underlying inflammatory process going on.
I am hypothyroid. I have had hypothyroid since about 2009. And at least I was diagnosed with it in 2009 because of a skin rash that appeared that wouldn't go away. And I started on Synthroid as a supplement for thyroid, and that cleared up the skin condition. And but one of the problems I had, even with the thyroid medication, was I was unable to sleep at night. Through the night anyway. I could sleep at night, but not through the night. And I was tired even after sleeping at night. And with this diet and nutrition I am on, I'm sleeping through the night. I feel much more relaxed and rested at the end of a night's sleep, and ready to get out of bed and spring out of bed when the alarm goes off, instead of wanting to push that snooze button over and over again.
Exactly. And we actually found out that you have Hashimoto's, which is an autoimmune thyroid, which you told me you had never been diagnosed with. Even though they ran the tests They never told you that, and that always takes a priority when it comes to any type of condition.
Right.
Yeah. So there's going to be a lot of people watching this, you know, and we send them to the website because, you know, different conditions, vertigo, obviously, people that are have chronic lower back disc problems. But what would you say to those individuals that might be apprehensive? Because, you know, there are a lot of people that are not certain. You know, they hear a chiropractor. What does a chiropractor have to do with nutrition? What does a chiropractor have to do with vertigo?
Right. Well, I have to say that I had not gone to a chiropractor before I had a back injury.
Okay.
And I went to you and a previous chiropractor
Right.
because of this injury, because I was desperate.
Right.
You know, the alternative for me was surgery.
Yes.
And I have had friends and acquaintances and heard of other folks that have had back surgeries. And the key is surgeries. You have one back surgery and typically you have another and another.
Right.
So I wanted to take this approach with Dr. Leonard to heal my body and not to just go in and remove a disc that had gotten out of place and inflated or herniated.
Right.
And then possibly have that come back again in another disc or that same disc.
Right.
So
right.
I took this approach.
So you can say Dr. Leonard, Dr. Michael, because I'm Dr. Michael.
Yeah, Dr. Michael started with you, and mainly I've been working with you, Dr. Leonard.
Yes, both. Yeah, so it's a both. You got both doctors for the price of one.
Yes, that's another benefit of working here. So
absolutely,
it's great. So,
that is awesome.
And the other thing that drew me here was the holistic approach to medicine and to heal the problem at the root cause and not to treat symptoms.
Right.
And then, of course, the least invasive way to cure a problem for me is the better way.
Yeah, because you're
the surgery at all costs.
Yeah, because you're a pretty analytical person. You're an engineer. So you're analytical about making decisions and odds and, you know, outcomes and all that, right?
And when you see the amount of people that have a surgery in the lower back and then later have another and another, to me that just was not the best or the obvious approach for me. And I want to get back to being, you know, as active as I was before the injury. And you know, I think this is the right road for me, and it's working. And I'm, like I said, I'm walking distances and beginning to do things that I haven't been able to do back in the gym and working with weights and different things.
That's cool.
So,
that's because it's all about strengthening now.
Right.
Absolutely. And so people are probably wondering why you're shaking, but he's on a whole body vibration unit. I'm going to turn this upside down, and he's doing this because when he first came in, his hip was about 3 to 4 inches higher, and now today it's pretty well level, maybe about a half inch off. So substantial improvements. Well, thanks so much, David.